Hi guys, I just wanted to come on here today and go through a couple tips about how to optimize fertility. So this is week 1. I'm mainly going to talk about one thing, and then each week from here on out I will be doing one topic as well. Today I want to talk about vitamin D, because vitamin D is very important in overall health in general. It affects every cell within the entire body, so it can help with immune systems to keep those up and regulated properly so that you don't get sick as much. It helps with depression, and that's kind of why this seasonal depression comes in, is a lack of vitamin D. It's also shown to kind of have an impact with multiple sclerosis patients as well, just to kind of really regulate the body. It helps with autoimmune cases and everything like that. A couple other things that it helps with are improving sperm quality and lowering the risk of preeclampsia, premature delivery, and pregnancy complications. It increases overall health during pregnancy and decreases the risk of asthma, eczema, and infections in the newborn. And it also decreases the risk of mom having a vaginal infection with group B strep. So overall, this is just a good supplement to be on pre-pregnancy, during pregnancy, and even after pregnancy to help with postpartum depression and infant health and everything like that. It also helps to regulate insulin responses. So PCOS is actually something that's driven by insulin, and it's not an ovary problem. Actually, it's the insulin response is so high that it converts the estrogen within the body to testosterone, and that's where all the symptoms kind of come into play. So by taking vitamin D, that can help regulate that, along with other things with diet changes and stuff like that. A lot of the times with vitamin D, you need to have K2 and magnesium to absorb it properly. But those can be either supplemented or taken with, they're easily absorbed with food. And yeah, so vitamin D is just something that I highly recommend for pretty much everyone to be on, especially when we live up in Minnesota. The likelihood of you having a high enough vitamin D level with the weather that we have is not very high. You also don't absorb vitamin D when you have sunscreen, because it's the UVB rays that hit your skin that actually produce it, and those UV rays are what sunscreen blocks out. Optimal level of vitamin D is actually between 60 and 80. Normal labs tell you it's 30. So that's one of the things too, where a lot of people say that they've had their vitamin D checked, it's fine. But if you're not above 50, you're going to show symptoms of not having enough. So those are just my tips for today, and stay tuned next week.